This tutorial will demonstrate how to add and adjust an electronic patient file in the MDScripts software. There are several ways to add patient files in order to dispense medication, track health progress, manage refills, and so much more. The first way is to simply enter their information during a dispensing transaction. For example, if this is the patient's first time visiting the practice, you can enter their information at the time of dispense and it will save their file for the next time they visit. The second way is by going directly to the Patients tab and clicking the Add Patient link. This will take you to an entry form where the patient-specific information can be entered and saved for future use. The third way is through electronic import. Some customers are either currently utilizing an EMR software or have an existing database of patient files that can be uploaded into MDScripts. Many EMR platforms have already been successfully integrated with MDScripts. If you are currently using an EMR and are interested in establishing a direct interface, contact your Aidarex representative to determine the feasibility of the integration. If you have a system that can export patient data into a CSV file format, the patients can be easily imported. Simply click on the Patients tab and click Import. From this screen, simply click on the Instructions link and follow the CSV import instructions provided. Once a patient file has been successfully added, you can edit and update the information as needed by clicking on the Patients tab, searching for the patient by name, and selecting their file. On the patient screen, there are several different patient-specific options you can choose from. Clicking the Dispense Card option will start a new dispensing transaction. If you are maintaining hard copies of each patient file, you can print their chart by clicking the Print Chart option and save a copy in their paper file. The RX form is a patient-specific in-office medication request form detailing all of the medications available to prescribe or dispense based on your formulary. The medication profile lists the medications that have been dispensed to the patient from your practice. Clicking the Prescriptions option allows you to write a new prescription for medication or view previous prescriptions that have been written or voided. The DUR, or Drug Utilization Review option, will allow you to check the different contraindications that may arise if you dispense or prescribe medication to the patient. This is based on their current medications they may be taking, or previously prescribed, any indicated allergies, or specific illnesses or medical conditions they may be afflicted with. The Fax RX option is a faxable prescription request form for any medication that is not on your formulary or is not going to be dispensed in the office. Visit documentation is where you can post patient vital signs sorted by the date of service. The Add Notes option allows you to add general notes to the patient's chart. The Alert option allows you to add a note that will appear on the patient's electronic account each time you open their file or attempt to dispense to them. For example, if their insurance does not cover a certain medication, you may want to add that note as an alert that is seen right away so alternative options can be discussed at the time of dispense. Many practices are by appointment only and have a set schedule of the patients that are coming in well in advance. Oftentimes, they also know exactly what to dispense to them prior to their visit. You can use the Queue option to queue up patients for the day so when you go to dispense, they are already pre-populated with everything they need. The Claims option is used for workers' compensation claims. You can post patient claim numbers and authorization IDs in this section prior to dispensing to save time during the actual transaction. For a monthly fee, the MDScripts software provides the option to e-prescribe. This allows you to forward any prescription sent from an EMR to MDScripts or to another pharmacy if the medication is not going to be dispensed in office. Contact your Aidarex representative for more details.